Of course, we know that this year's theme, the theme for this year's World Malaria Day is Zero Malaria Starts With Me. You're welcome once again. Let's start this way. Yes, malaria, people are actually focusing on COVID-19 now, but with the World Malaria Day has come to remind us again that we must take malaria very serious. Of course, malaria is also I think acute malaria is also one of the symptoms of COVID-19. So, what is the focus of the Ogun State Ministry of Health as we have another celebration of the World Malaria Day today?
Thank you. As we have another focus now for 2020 World Malaria Day, we are saying zero malaria starts with me. Even in the face of current reality of COVID-19 pandemic, malaria is a disease that we cannot wave aside because it's been with us, it's endemic. So we won't say because of what we are going through currently, then malaria will be at the back burner. Coupled with the fact that malaria is preventable, is treatable, and is curable. That is the focus for this year. April 25 of every year is commemoration of World Malaria.
Now, if I don't want to have, okay, let me ask this question, doctor. Some people believe that well, malaria is their only sickness. They might not be sick all through the year, in 2 years, or whenever they are sick. It's only malaria. Is it natural to just have malaria? When you have malaria, it means something went wrong.
Everybody is at risk for malaria because of our environment. The mosquito that causes malaria thrives well in sub-Saharan Africa. So if one is bitten by this female Anopheles mosquito that carries the parasite, definitely one will have malaria. But it is possible not to have malaria because if the mosquito that bites, that carries the parasite does not bite, then the person will not come down with malaria.
So it's not about whether you are AA, you are AS or something?
Irrespective of your blood group.
Your blood group, yeah?
Irrespective of your blood group, you can have malaria. There are two vulnerable groups. We have children that are under 5 years of age, and we have the pregnant women. They are more vulnerable to malaria, but other population groups too are vulnerable. And that is why we are saying zero malaria starts with me.
And I wanted to ask her, how? How can
because
I have?
Because at every level, we have responsibility to make sure that we prevent malaria. From the government to private sector to non-governmental organizations to individuals. So if we are saying it starts with me, it means I can actually prevent malaria by myself. What can I do? What are those things that I can do to prevent malaria within my own household? And we are saying environmental management is key. By the time we clean our environment, avoid stagnant water where mosquitoes can breed, then we will say that malaria, is something that we can reduce to zero. And even at governmental level, the federal government, the state government, the local government, they have responsibility of ensuring that policy directions are put in place for the whole system to follow, and also to make available things like test kits in the facilities where people can get tested, and if they have malaria, they get the correct drug to clear the parasites within their system. So all these are the package that we have for World Malaria Day to increase the sensitization and to create more awareness that malaria is still there. We are fighting. All efforts are being put into eliminating malaria, but we are not there yet. But we have gains that we have made. At least when we look around, we see that mortality due to malaria has reduced by about 62%. That is a gain. We've seen that the prevalence of malaria has actually come down from 42% to 23%. Okay. That's a gain. So these are gains that we have. We may say yet we have not eliminated malaria, but we have some gains recorded. And WHO is saying that at this time, because of COVID-19, we should not lose those gains. Because malaria and COVID-19 have some similar symptoms. Symptoms like fever, headache, weakness, they are similar. They share such symptoms. So it is important to say that your fever could be due to malaria. The only thing that will tell you if it's malaria or not is if you are tested. And there comes the importance of testing. Because disease conditions that are associated with fever are many. Beyond malaria and COVID-19, there are some other disease conditions that records fever too as a symptom. So it's important to get tested so that we will be treating the correct disease.
There was a time when we were young, and of course I know that I don't know, we normally take what is called Sunday medicine. They say it prevents malaria. You must be on it every Sunday. You take it every Sunday. Then, I mean, how true is it? Is it still reliable?
In our own environment, because as a country we have what we call malaria policy, and we have malaria treatment guideline. In our guideline, and as a country, we have come out to have a policy that says that when there is a feeling of unwellness, you get tested, and if you have malaria, that's if it is positive, you get treatment.
Okay.
So for Sunday medicine, we don't have that in our own policy.
Okay.
Because if we prevent appropriately, then
no need to
you don't need that.
Okay.
But for pregnant women, we have what we call intermittent preventive treatment for pregnant women because they are a highly vulnerable group. So this preventive treatment involves the use of a drug 1 month apart, whereby malaria is prevented among that group. And that drug is given in health facilities under the supervision of a skilled health worker. They are not supposed to take it by themselves.
WHO came out recently to say that, well, malaria problem co-aggravates, especially in sub-Saharan Africa, because of lack of adequate net. That's scary. I think there was a time people have been begged to come and collect nets here and there, and of course I know you also say that net prevents when you sleep under malaria treated nets, then you are likely not to have malaria or not to be bitten by mosquitoes. What is the situation as per net now?
For nets, we have what we call LLIN campaign. That's long-lasting insecticidal net campaign, and we have replacement campaigns every 4 years. That is when nets are distributed to households.
So one net, that net can only have a lifespan of 4 years?
Yes.
Okay.
4 years. After 4 years, there is a need for a replacement because the insecticide in it, the effectiveness will begin to drop and things like that. So what WHO is saying is that there are countries, there are states that needs to have their own replacement campaign during this period. And if they cannot do it, we may begin to lose some gains, like I said earlier. For us as Ogun State, we had a replacement campaign in 2018, where early lines were distributed to households across the state. So we are not due for another campaign in another 2 years.
Okay.
And as such, we have nets available in Ogun State. But for some states and some countries that are supposed to have their replacement campaign within this period, they may have that challenge.
Okay. All right. Well, is the World Anti-Malaria Day, World Malaria Day, beg your pardon, with the theme Zero Malaria Starts With Me. I'm looking at definitely you must have maybe planned for 1 or 2 programs to sensitize the people that it is another World Malaria Day. This is what you should do, and that involves mixing maybe programs in some medical areas, medical centers where you meet people. Unfortunately, COVID-19 pandemic is here. How do you take this message to the people now apart from what you are doing now, so to say?
The sensitization on malaria is not a one-off thing. It's something that we even do before World Malaria Day. World Malaria Day is just a day that has been set aside to increase that awareness. So we do interpersonal communication at the community level. We have interpersonal communicators that move around to households and they speak to them about malaria prevention. They have the opportunity of asking questions, and if they have areas where they need clarifications, these interpersonal communicators, they discuss with them and they enlighten them. They also support them to hang their nets for households that have difficulty in hanging nets, and they also help them out in linking them with close primary health facilities. And primary health facilities, public health facilities are opened throughout this period, even during this COVID-19 pandemic. So where people can walk in and get tested, and if they have malaria, they get treatment. In all the primary health facilities, these services are free. The tests and the treatments are free for malaria. So these are things that are ongoing, even beyond the World Malaria Day. These activities will still continue. And any opportunity we have to, we use it to sensitize the people and to create more awareness. To say that zero malaria in our society all lies in our own, in our hands. It's not just the work of the government. Even as an individual, as a community, I have a part to play.
For mothers nursing infants, so to say, babies, how vulnerable are little babies to malaria?
Children are very vulnerable to malaria, especially children that are under 5 years of age, highly vulnerable. So it is important for mothers to understand home management of malaria, in the sense that by the time the child has fever, it's not for them to just start treating malaria on their own. Because fever among children can also be due to some other things. Even infection can make them to have fever. So it's for them to just tap a sponge, try to bring the temperature down, and then take them to the health facility where they will be treated appropriately. So for mothers, they need to be very sensitive, and they need to watch out for symptoms that may mimic malaria in their children. And it is also for mothers to prevent malaria among under fives. At home, they should make sure that children are not bitten by mosquitoes. Use long-lasting insecticidal nets for children so that they are protected.
How healthy is the use of insecticides, fleets? And of course, if it is okay, how should we use it? Because at times you get into a room, you feel uncomfortable because of the thickness of the insecticide, and of course, thank God that we no more in the period where you remember that time where they will use coil for, and of course that could cause I don't know. But from the health perspective, how relevant? I mean, how healthy are these insecticides?
The use of insecticide sprays is not as if they don't work, but we are saying that for a household that's looking at economic aspect of it, is more expensive than using a net. And also there may be some other reactions, just like you mentioned, things like respiratory reactions and things like that. So for us as a program, we always look at something that is economical, what is effective, what is affordable, looking at the population, because we are not just focusing on an individual or one household. We are looking at the whole public, the whole state. So we are looking at something that is affordable and at the same time can also be that effective. And that is why we don't distribute insecticide.
One important question before we wrap up. I know that maybe while you were growing up, you must have experienced it too, because we experienced it, and of course some people still do it in their household. There's this herbal thing for malaria that it doesn't matter whether you have malaria or not, you drink intermittently, and of course even if you have malaria, they will say, okay, if you take drugs, don't drink this herbal thing. But it's been in existence for long, and they still use it. I don't know, what's your view on this?
A lot of research has gone into the use of herbs.
Agbo. Agboba.
To treat malaria, not just malaria, even some other disease conditions. And what we say is that, do we know the dose of agbo to take, as an individual? Because even two individuals that are of the same age may not have the same, what is happening within their system may not be the same. The combination of the agbo that is being taken, a lot of people don't even know the right combination to take. We don't even know what is inside. So it's not as if those things don't work.
Okay.
But we need to be careful in terms of dosage, in terms of knowing the combination, how toxic, for herbs, for leaves and roots and barks, all these things, some of them still have little toxic property or something that can cause a reaction in an individual. And these are the things too that are put together to prepare orthodox medicine. Look at the drugs that is being used to treat malaria. That's the ACT, artemisinin-based combination therapy. Is made from a plant, Artemisinin annua. That's the plant that is used to make the anti-malaria. And that is what we are using currently to treat malaria.
All right, as we go, what will be your message? What will be the message from you for us to take home on this World Malaria Day 2020?
As we go, my key message to our people is that we should not stay at home and cover up ourselves, because your fever could be due to malaria. So it is important to get tested. We are saying that COVID-19 and malaria share some similar symptoms. So we should not just stay at home and be taking ginger, just staying inside the sun as a result of fear. That, okay, this may be COVID-19, I have fever, I have this, and the person will just stay at home without coming out. We are saying that fever is not just due to malaria or COVID-19 alone. It is important that we come out and get tested. And as we commemorate 2020 World Malaria Day, the zero malaria lies in our hands. We have a part to play. All hands should be on deck. Malaria is preventable, it is treatable, and it is curable. So as much as possible, we should all in our different households and in our different communities prevent malaria and make sure that it is eliminated from our environment. Thank
you very much, Dr. Mrs. Olamide Adeyinka, the Program Manager, Malaria Elimination Program, Ogun State Ministry of Health. And of course, we've been talking on the World Malaria Day, which is today, this Saturday. And of course, don't forget that the theme of the...
There is nothing strange to our Creator. To human beings, of course, some things will happen that will go beyond our comprehension. But the fact is that the God that created us knows the events that will happen at one time or the other. Like you said, that in your generation, maybe the same generation too, we are seeing this kind of development. And that is to say that for Muslims that are used to the usual religious routine in terms of going to mosque collectively, going to Hajj, if I can imagine, so many people will have saved some money with a view to visiting the two holy mosques. But look at it. To us, deeply, we felt God Almighty want us to be innovative and see the other side of reality of life. And what is this other side? To so many people, they could not fathom the fact that we could not go to mosque and do Jumat. And that was why some cleric defied the order of the government and said, we were going there, but they met their Waterloo. But let me say two things. One, Alhaji Hakim, do you know that in Islam, if intentionally you consume or you eat garlic, you know the odor of garlic is very offensive.
Yeah, sure.
The Prophet ﷺ said, once you eat it, don't go to mosque to pray Jummah. You know why? Because the offensive odor in your mouth can bring or create inconvenience for the next person standing
beside you. Yeah.
Somebody has not had that before, that a situation could make you not to go to mosque and pray. That's one. Secondly, if you suffer a deadly disease such that you cannot stand up, you cannot do anything, you are allowed or permitted in Islamic law to remain where you are on the bed and be praying in that posture. Thirdly, do you know that when you have heavy rainfall, I'm not just talking about ordinary shower, heavy downpour.
Yeah.
The injunction of Islam is that everybody should pray indoor. In fact, we do not expect any muazzin, the man that calls to prayer, to go to mosque and use the microphone and the speaker. These have been there before COVID-19. Now bring COVID-19 in. COVID-19 is telling you that if I see the two of you together closely, you are going to die. For example. COVID-19 is saying that mere clustering of people, you will carry the virus, you will spread it. Then, Islam will be a disappointing religion if at a particular happening of an event, there is no immediate response to such event. And that's why Allah says, this religion is a religion of reality. It's not a theoretical religion. That somebody will say, I have no answer. There is no answer to some questions. So Allah wants us to now be innovative. Think deeply. Those of us who know how to read so many texts in Arabic, Allah wants us to bring it to reality. You know, it's one thing for you to parrot the Quran, wanting to parrot the Tira, everything that you know. But the reality of your existence is different from what you are reading. More so, the revelation, the circumstance of revelation at the time of the prophet may not necessarily be the same thing with our reality today. Yet, we must bring them together.
Let me
now,
okay.
No, before I leave that point,
yeah.
One of our professor of Islamics, you know, you call it Islamic studies, but in the real terminology it is called Islamics.
Okay.
Said yesterday that mosque is not a shrine. I don't know whether you get what I'm saying. That somebody will say, no, unless I go to mosque, I have to pray. Unless I pray. It's not a shrine. It's just a place for convergence. For you and I to see ourselves again. We saw yesterday. This morning we also see you.
Well, you clerics made it clear to us a very long time ago that
Yes.
there is more benefits, reward from Allah in
If you bring
observing
to congregation,
Sharia.
Ad-daruratu, the exception to that is that ad-daruratu tubigul mazurat. To every general rule, the exceptional situations are there. COVID-19 situation is an exception.
So
let me tell you, for
Allah
this,
knows in your mind that you want to do congregational.
no, he knows. You don't even need to say that. Oh Lord, you see, it's COVID-19. He knows already, and that's what he has said. That you know, some people today they are not coming in to terms with this issue of COVID-19. Initially, we know some of our professors, some of our learned, Islamic scholars that believe that it's a phantom. It's not real. They put out so many write-ups. We tackle them and say, you are not getting it. We are not doctors. The health professionals are telling us this is the reality. Now, in this year Ramadan, very, very unique and strange, if I use your word. One, we are missing our collective Taraweeh. We are missing our regular tafsir. we are going to miss, of course, unless it has disappeared before then, our Lailatul Qadr. I know you always participate, the one Al-Barka always organize. Our usual pre-Ramadan lecture, unfortunately, Ogtv could not also organize one this year. All these clustered programs that we have, we are going to miss them. Missing them does not mean the reward for them or the alternative to do them are not there. And what do I mean? There are so many programs today that are being done virtually. For example, if you do tafsir in your mosque congregationally, there are so many platforms created that have allowed or will allow your members to hook on and they watch their leader, spiritual leader, and get the message.
Is it not some of these things we have to resort to actually not miss out properly? I mean, entirely. Talking about let's leave congregational prayer, let's leave Jumat, talking about tafsir, talking about probably program for Lailatul Qadr. You are talking about the options now. Now, when you look at the options, if you don't have education to some level, you might miss out. Is it not a reason to a fact that even Islam said you must be educated and does not specify?
No, maybe I took it from the highest level.
The whole.
Yes. One of the precautions, stipulated by the NCDC is that we should wash our hands, we maintain social distancing, we use face masks and the likes. What coming together has prevented, what COVID-19 has prevented us from doing is coming together.
Yeah.
But COVID-19 has not prevented me from asking the radio station to record my voice.
No.
COVID-19 has not prevented me, like I'm here now, it's an opportunity to pass the message. COVID-19 has not prevented any religious, organization, individual or group from recording programs. So what it means is that where you used to have live programs, you have ajanasi, you have parade of scholars following you, that must be reduced or removed. Scholars should now think out of the box, and be able to say, okay, how else can we pass the message? Recording is there, is allowed. You record your voice. Television you can
also record,
and so on and so forth. I know of somebody, he doesn't come to a TV station, but he has a regular Facebook programs. And people follow him massively. So these are the options we need to do. On the issue of education, Islam is a very sensitive religion. You can't just stand up and say you want to do this and you go scot-free. There are some of our traditional scholars, like we still need to talk to. We need to encourage them. All these things we are saying, maybe because of our level of education, they do not want to hear them. In fact, they don't even know them. Some of them do not want to even know them. And that's why even today, some of them still believe that for you to sight the moon, you still need to use your naked eyes. No, that is not the progress Islam is talking about. Islam is a progressive religion. So for scholars, like the Nigerian Supreme Council of Islamic Affairs did, the body constituted a fatwa committee. This fatwa committee look at all the jurisprudence that we have, from various scholars, and they came together and said, no, we are on a good standing. If we stop all these activities, you have not missed out from the religion. And look at Allah. Allah says, La yudiwa amalan amelominku min zakarin wa unsa. Individually, if you do all these activities in your house, Allah will not decrease your religion.
I'm still coming back to the issue of sighting of moon and the issue of a little bit of controversy as far as the Ramadan is concerned. But now, let's go to iftar. Many people are, used to organizing congregational iftar.
Yeah.
They have it at plans.
Yeah.
It's part of them.
Yeah.
So what is the options now for them?
No, the option is that whatever you used to cook,
serve it raw.
Serve it raw. Even if you cook it,
okay,
you can still
serve it. Yeah.
Do you understand?
You don't need to bring them together. You
yes.
know where to serve it to.
The important thing is let the food get to the appropriate individual.
You can even have a food bank where people will come and collect.
So we need to be. I said it that God wants us to be innovative. And this innovation this time around is good one. We must find a way, you know, those of them that used to distribute money now, you don't need to see anybody face to face. You can make as many transfers as possible. You can buy food, you can cook, you can distribute, you can reach out to various houses. And of course, we are thank God that even the government allows us to do essential services in Ramadan, they will understand that is an essential service.
And of course, talking about having a lot of programs on air, just like you said, especially it is when we need it and on TV. But you realize, because I'm talking from experience, that there have been a whole lot of decrease. Maybe we have, if you have about 80 programs on radio and TV last year, maybe we are not having up to 15 now. And of course, they also have a tangible reason, which I think Islamically, you will comment on that. Well, instead of spending money, sponsoring programs on radio and TV, we want to use that money to organize palliatives for our members who might be hungry. If you are, or if you don't know what, you don't have what to use to commence your fasting, will you listen to radio or television program? So,
no, the two are allowed. The two should also be encouraged. We should not sacrifice one for the other. The only thing is just that where you know that somebody needs to eat, don't bring money to Hakim for any program for sponsorship. No. But if God has blessed you, you have enough that if you combine Ogtv, any of the stations together, you still have excesses. We expect you to feed mouth more this period than spending money either on the radio or on the television. Let me tell you, for me, I take this COVID-19 beyond a disaster to us. Because it's coinciding with Ramadan. For the Muslims, we should see it as an opportunity for Allah, giving us a leeway to be able to reach out more.
So it's a tafsir on its own.
On its own, in fact, you don't need anybody to talk to. You are doing two things. You are feeding people to break their fast and to fast in Ramadan. You are also extending your own little wealth to every individual. Don't forget, the palliative you are extending in Ramadan is not only to the Muslims. As a matter of fact, if you are surrounded by non-Muslims, it is even a more blessing for you. And that is to tell you that God wants you to see humanity. He doesn't want you to see religion. He wants you to see human beings suffering, and you are alleviating, this suffering. Now, if you don't have more, please feed more mouth. And I have to emphasize this. Hey, I pray that we get out of this pandemic. And I was here some time ago, I said it, that if we continue like this, we are shouting on government, we are trying to go on rampage, we are threatening to, demonstrate. Demonstrate for what? Against what? Because government will not be convinced that this pandemic is over if every day, day in, day out, we are still seeing the increase in number. So, where we have more number of this casualty or victims or patients, then the more time we are likely to spend indoor. But the more we stay indoor, the more this will become a threat to our peaceful coexistence. What do I mean? In my area, 2-3 days ago, in the afternoon, we saw the emergency work that was done by the security agencies. Hoodlums, armed robbers everywhere. I even said it. If you are not
in broad daylight,
I'm telling you, around 1 p.m., 2 p.m. If you are not careful, Alhaji Hakim, you will go out there. They will stop you and say, bring your wristwatch. We are going to sell it to feed. So we don't pray it get to that level. Amen. So, if everybody has, please prepare food, cook food. See, this thing is terrible if you don't know. Alhaji Hakim, do you know today, If you give somebody 500 naira now,
Yeah. It's like,
Eh?
I know.
one of my former staff, I just saw him somewhere in Shakmo. He didn't see me. I said, driver, stop, call him for me. I was the least person to see. And I said, okay, you are calling Okada, yeah, take. The guy was confused. Because he could not imagine. 500 naira. It was like 5 million naira. So if you have, please, and again in Islam, do not wait until somebody asks you.
Yeah.
Some people, they will be so shy, they may not be able to ask you. But Allah saying directly, they will ask you. Give them.
Read the body language.
Give them. There are some that will say, Alaji Hakim, well done, how far now? This iftar, how they go, they go. He's telling you, am I invited in your house? Don't let him wait. So my message is that, please, let all of us be magnanimous. Let our benevolent spirit increase more in this moment.
That's how we will go on the program, and that's okay about Barrister Mutiu Agboke, and we'll be talking about the Ramadan. We don't have too much time on our side, so we have dragged them and dwelled on so many things concerning Ramadan at a very strange period of COVID-19, so to say, and we've been having a chat with Barrister Mutiu Agboke, who is a national missioner of the Al Baraka Islamic Society of Nigeria. Once again, we want to say